Doctors and nurses have been leading the battle against the pandemic in Peru, and the fight has taken its toll. Many medical workers who treated COVID-19 patients became infected themselves.
Behind me are the 36 doctors who have lost their lives. They represent the most painful part of what you see on the facade of our building. We also have 1,300 medical doctors who are ill, of which 23 are seriously ill in intensive care units. That is the reality for doctors in Peru.
After Brazil, Peru has the second highest number of infections in Latin America. But the crisis, say doctors, is that Peru's short-staffed and ill-equipped hospitals cannot cope with the rising number of cases. Even in Lima's largest public hospitals, which treat hundreds of COVID-19 patients.
It's really hard because here in this hospital we are almost 50 surgeons. So by the pandemic we are working only maybe 20-25, no more. Okay, so because there are surgeons more than 60 years old, surgeons with, complication, heart hypertension, obesity, etc. So now we are only 25. And these 25 surgeons try to cover all the patients all the day, every day, 24 hours, 7 days per week.
Outside the capital, the situation is worse. Medics lack basic protective equipment, while patients struggle to get medicine, oxygen, or intensive care beds. Peru's state social security service has worked against the odds to manage the crisis.
We were lacking some 9,000 nurses and 5,000 doctors to give proper care to the patients. We had begun with a huge deficit, and if we put Lima to one side and look at the rest of the country, the deficit is even more serious.
Field hospitals have been hastily built in COVID-19 hotspots across the country. Peru's President Martín Vizcarra says Peru has high numbers because it's testing more than any other country in Latin America. That data is being used to map coronavirus hotspots for special attention. This is the nerve center of information about the spread of COVID-19 in Peru. This so-called heat map shows the concentration of infection city by city, street by street. Studies show many virus carriers do not show symptoms. And with 20% of Peruvians living in poverty and 7 in 10 with no fixed income, millions have little choice but to go out and risk bringing the disease home. Dan Collins, CGTN, Lima.